A speech disorder is a condition in which a person has trouble communicating with his colleagues or groups of people. A speech disorder is often caused by genetic or past trauma experience. Common speech disorders are stuttering, dysarthria, ADHD, and rhoticism. A stutter is a speech disorder that affects 1% of the population. It is the repetition of syllables, words, or sounds. It often occurs in children between the age of 3 and 6. 1% of the world population is diagnosed with a stutter. A stutter can come and go depending on the circumstances the person is in. Stuttering is still a broad topic that scientists are still unknown of. However, scientists have figured out that the cause of a stutter can be split into two segments, a development stutter and a neurogenic stutter. A development stutter, like the name suggests, is a stutter that the person had when they were a child. Some children outgrew their stutter. However, development stutter is a condition when people who stutter continued through their life. A neurogenic stutter, on the other hand, is a stutter that is caused by a stroke, head trauma, or other types of brain injury. It is also worth mentioning that a development stutter can be passed on by genetics. Symptoms of a stutter vary throughout a person's day. Usually giving a speech in front of an audience or talking to a group of people may cause the stutterer to be severe. Symptoms of a stutter include the following: prolonging a word or sound within a word, anxiety about talking, limited ability to effectively communicate, repetition of a sound, syllable, or word, and difficulty starting a word, phrase, or sentence. Since a stutter is still being researched, scientists have not found a cure for a stutter. However, scientists have come up with numerous recommendations to reduce a stutter. For instance, speaking slower, reading out loud, breathing exercises, and also speech therapy. There's a certain misconception about people diagnosed with a speech disorder. They are limited to what they can do. However, certain celebrities and well-known people have fought through their speech disorder. As an example, Joe Biden, as you may know, who is the 46th President of the United States, he was diagnosed with a stutter at a very young age. However, his continuous stutter did not limit his ability. In fact, Joe Biden defined his stutter as it has nothing to do with your intelligent quotient, it has nothing to do with your intellectual makeup. He accomplished so many goals with his stutter by working with it and not fearing it. For instance, he became the youngest politician in his hometown, Delaware. He served as the 47th vice president. He is the 46th president of the United States. He has been in politics for over 40 years. Even though Joe Biden still has a stutter, he surely overcame his fear of it and is now serving as a leader of the United States. Like other speech disorders, such as rhoticism or dysarthria, stuttering can change a person's behavior. People become self-conscious of themselves stuttering, which can lead them to not talking as much as they would like to, because they would think that other people would find constant stutterers annoying. The thing is, stuttering is an affliction that is prominent in many people. It can even sometimes come out in people who don't normally exhibit it. The problem was that it used to be made fun of, which is demeaning. However, instead of undermining and mocking each other, people now try to help each other and share personal ways in which they battle stuttering. This not only strengthens bonds between people, but also widens everyone's knowledge on the subject, and obviously helps people in reducing their stutter.
Dysarthria occurs when the muscles you use for speech are weak, or you have difficulty controlling them. Dysarthria often causes slurred or slow speech that can be difficult to understand. Dysarthria is a motor speech disorder. It affects the movement of the individual's speech muscles, and it can vary from mild slurring to completely unintelligible speech. The causes of dysarthria depend on the type of disorder. Both types can occur at birth or develop later in life. Some causes include brain tumors, dementia, side effects of certain medications such as sedatives and anti-seizure drugs, stroke, traumatic brain injury. Signs and symptoms of dysarthria vary depending on the underlying cause and the type of dysarthria. They may include slurred speech, slow speech, inability to speak louder than a whisper or speaking too loudly, rapid speech that is difficult to understand, nasal, raspy or strained voice, uneven or abnormal speech rhythm, uneven speech volume, monotone speech, difficulty moving your tongue or facial muscles. Treatments of dysarthria depend on the type of dysarthria a person has and how severe it is. Some treatments include slowing down your speech, using more breath to speak louder, making your mouth muscles stronger, moving your lips and tongue more, saying sounds clearly in words and sentences. Dysarthria can cause affected individuals to lose confidence when talking. As a consequence, social difficulties may arise, therefore affecting your relationships with family and friends and making social situations challenging. Moreover, the presence of extreme cases is inevitable as it may even lead to depression and social alienation. Like other speech impediments, dysarthria, as previously mentioned, can have a devastating effect on a person's mental health. Luckily, people have come up with solutions to this problem, such as hiring speech coaches to train people on how to mitigate effects. This camaraderie helps people understand each other better, and instead of undermining people who already undermine themselves, they try to help them in any way possible.
Rhoticism is a speech impairment that makes a person unable to pronounce the sound R. This impediment can also be called deroticization because the sounds don't become rhotic, rather, they lose their rhotic quality. It has nothing to do with certain muscles functioning improperly, but rather with the fact that the person thought that that was the correct way of pronunciation without anyone telling them otherwise. Only 2% of the population are affected by rhoticism.
The only known causes for rhoticism are the fact that the affected individual thought that he or she was pronouncing it correctly and no one had told them otherwise, or the parents had assumed that their child would grow out of it eventually. Some people try to hide their impediment by avoiding sentences with many R's in them, like the really red rose. Using trilled R's or guttural R's, such as the French R, when trying to pronounce the regular English R. It's very noticeable in other languages in which the R is more accented, such as Russian or Arabic. The only treatment for autism is speech therapy, which could be aided with tools. In speech therapy, an individual will be taught how to correctly shape their mouth and tongue in order to pronounce R. Homework could be given during which the individual will sit in front of a mirror trying to mimic the correct mouth shape. Surprisingly, it's never too late to learn how to pronounce your R's correctly. In comparison to dysarthria or stuttering, goticism is a more common speech disorder among toddlers, but less common among teenagers and adults. However, this is not to say that there are no adults or teenagers who cannot pronounce their R's. Furthermore, goticism, much like other speech disorders, is considered a touchy subject for people afflicted by it. Pointing out a person's flaw, even with the right intention, could seem demeaning to the person. Therefore, in extreme cases, people could choose to become isolated from their friends and family simply not to be reminded about their impediment. Rhoticism, like other speech disorders, has certain benefits to society. It might not seem obvious what those benefits can be, but they have actually helped quite a bit in making a more accepting world. Firstly, people are barely making fun of each other anymore since speech impediments aren't considered to be a laughing matter. Secondly, it has created a new line of jobs helping with unemployment. People who aspire to help others can now do so by learning about individual impediments and teaching people about correct ways of speech. Not to mention, leaning away from autism, new medications have been created to help people with ADHD, and scientists are attempting to create medication to help with stuttering.
While the exact cause of this disorder is unknown, three main factors may trigger the condition. The first factor being genetics, as this disorder may be obtained hereditarily. The second factor is the environment, as large exposure to lead at a young age may trigger this disorder. And the last factor is development problems, as the delay of the development of certain parts of the brain and problems with the central nervous system may cause this disorder. What are the symptoms of ADHD? Lack of focus, poor time management, forgetfulness, fatigue, impulsivity, relationship issues, numerous vocal repetitions, such as the repetition of word fillers, lack of motivation, and restlessness and anxiety. Although there's no single test to diagnose if a child or adult has ADHD, there are three main methods in which the effects might be reduced. Starting off with medication, stimulants may boost and balance the neurotransmitter levels, while antidepressants may inhibit dopamine levels, which lowers the levels of hyperactivity. Moving on to therapy, partaking in psychological counseling may help manage the behavior, as it can improve the patient's thinking patterns and develop better cohesive skills. Lastly, nutrition. Avoiding foods such as diet soda, caffeinated beverages, and sugary treats may also lower the level of hyperactivity. Due to a person's lack of focus, which is a symptom, as previously mentioned, of ADHD, they can start failing academically or in social activities because they are different from everybody else. This may lead to more severe effects such as depression, since the feeling of being an outsider among peers can be devastating on a person's psyche.